Good afternoon. All right, I'm going to be presenting on our Empower Her program. So here's the team. That's me up there. I am the co-founder and executive director of the Community Wellness Project. We're located in St. Louis, Missouri, and we also have an office in East St. Louis, Illinois, which is the southern region of Illinois. Our lead research and medical case manager is Bukola Apata. She gives her apologies for not being here. She should be the one doing this presentation today. She just had her first baby, Miss Alana. And then India Ivory is our women intervention specialist, and she actually runs our Brown Girl Brunch series. So just a little bit about CWP. We have been around for 21 years now, yay, as a Black-led organization in the Midwest. We're one of the largest ones around. We have been doing HIV and AIDS counseling and testing for that long, as well as care case management. I consider our organization a boots-on-the-ground organization. We work hand in hand with community. So I want to tell you a little bit about ViiV. ViiV sponsored our program. We were lucky enough to receive some funds to do the Risk for Reasons program, and Brown Girls Brunch and EmpowerHER came as a result of that. The Risk to Reasons initiative was designed to reframe and refocus HIV prevention and care for Black women. It was a mini grant, and it evolved into a larger grant, thank God. They really wanted us to develop new messages, new messengers, and new methods to increase awareness and action around HIV prevention and care for Black women. And that included cis and transgender women. So here was the issue. So even though the rates of HIV infection went down between 2017 and 2021, and the rate stayed steady for women in general, Black women have a 17.6 times higher prevalence of HIV than white women, lifetime risk of 1 in every 48 women in the United States. African women in the United States have an HIV incidence rate 6 times higher than the general population and nearly twice that of U.S.-born individuals. So I didn't want to not include seasoned women. I include myself in that. Some people say older, I say seasoned, you know. I think what's important here is that more experienced older women are often overlooked when it comes to STDs. HIV tends not to be at the center of our lives. We often aren't even thinking about an STD. There are a lack of programs and resources and support to help women like me to address sexual health and wellness, at least in the Midwest. And often mature women are not asked about their sexual lives during their annual gynecological exams unless there's a real issue. More seasoned women like myself often aren't going to see their gynecologist yearly, and so that's another barrier that we found with some of the women that we were working with, and they're often less worried about getting an STD from men who are of a certain age. I'll say it like that. So here's a little bit about Illinois and Missouri. So in Missouri, as of 2021, there were 13,856 people living with HIV. 633 people were newly diagnosed, and 18.8% of the newly diagnosed were women. In Illinois, as of 2021, there were 35,731 people living with HIV. 1,195 people were newly diagnosed, which was about 15.6% of those were women. I wanted you to look at the map here because if you're not familiar with Missouri and Illinois, St. Louis is in between the Mississippi River and the southern region of Illinois. So it's literally across the bridge, about 9 minutes. The laws in both states are really different, where in Illinois, there's a lot of strip clubs and bars in that area, a lot of sex work, a lot of substance use, and people can go back and forth across the bridge to receive services. And that really impacts the way in which we can receive services. For example, we can't do harm reduction distribution in St. Louis, but we can do it in Illinois. So if we have clients who need harm reduction materials, we tell them, meet me at the bridge, and I can give it to you. So why empower her? So here were some of the things that we knew from our clients. One is that there's higher rates of poverty in that area. East St. Louis is literally a food desert. Lots of substance abuse, lots of crime and use, high rates of trauma. There's social stigma and marginalization. There's lack of health care. There's cultural rearing that plays a big role in how people receive information and their ability to trust medical care communities. The environment is definitely a factor. And then there's some social connections, particularly with Black MSM in our area. So let me tell you a little bit about EmpowerHER. It's designed to empower Black women and girls with information and education about their overall sex, health, and wellness, and to utilize their own social networks to educate other women about health issues that affect their ability to engage and commit to HIV prevention and sexual health. So one of the things we really wanted to make sure that we did was educate and share information with women so that they could go back and share that information with their friends. So we had a friends influencing friends concept. So here's our goals. We want to raise awareness about Black women's options for HIV prevention and care. We wanted to be able to connect Black women to care if they needed, whether they were living with HIV or could be at risk for HIV. We want to change the narrative about HIV and Black women in St. Louis and the southern region of Illinois, which came about was the Brown Girls Brunch. And our goal here was to create spaces for Black women to communicate effectively about sexual health and wellness, and really to share some resources and identify the roots of their health issues and concerns. And that includes all health disparities, heart disease, diabetes, in addition to STDs and HIV. Mental health is a big issue in our area, and some of the cultural disparities, so that the women could really heal. All right. So here's some of the information that we wanted to make sure that we shared with the women. We wanted to make sure they had accurate information around HIV and STIs. We wanted to reframe their mindsets from focusing on negativity regarding the risk for HIV and STDs, and talk more about the reasons behind their risk. We want to empower women ambassadors to share knowledge about HIV and STD preventions with their social networks. So we really wanted to have that mother-daughter talk, or that grandma talking to their granddaughters about sexual risk. We wanted to provide information on sexual health and their overall wellness, including PrEP and PEP, and use the how to use the internal or female condom. In our area, believe it or not, many of the women didn't even know about the internal condoms. We want to address stigma regarding HIV testing and STD screening, and we wanted them to have the ability and comfortability to have conversations with their partners. So here are some of the Brown Girl Brunches that we've had. As you can see, the bottom right-hand person, that was our seasoned grandma, who was 66. And let me tell you, she could school the girls. She schooled the girls. But they really have a good time. We've done it in a paint and sip format, not just painting, but also painting their face. And then the education piece, which we think is awesome. Our last one was just 2 weeks ago at Southern Illinois Illinois University, and we had 65 women attend. So it's been pretty awesome. So we wanted to survey the ladies to see what else they needed to know and what they did know. So of the 1,300 plus women who we've served thus far, we've had 140 Black and African women participate in the survey. Those women were 18 and older. They live in the bi-state area, which includes Illinois, and we surveyed them over a 9-month period. We wanted to explore the following: Black women's awareness for their options for HIV prevention. We want to talk about the prevalence of communal and open discussions on sexual health and HIV prevention. We wanted to look at the factors that were most important to them in preventing HIV and their perceived best practices for themselves. And we also wanted to know what are the barriers to accessing and receiving services from women's health care organizations. And so here is the bio of the people who we surveyed. 98 women were African American, 35 were African born, and 7 were biracial. And we also had 5 transgender females participate in the survey. Their age range, again, was 18 to my grandma, who was 66. So here's what we found. 97.1% of the 140 Black women surveyed confirmed that they had knowledge about HIV testing sites, they had knowledge about condom use, and they knew that abstinence was a method of HIV prevention. However, most participants had never heard of PrEP or PEP. Isn't that alarming? And they assume that it is a medication for HIV treatment versus prevention, and attributes its use solely for the LGBTQAI community. So what does that say? Marketing, poor marketing. 77.9% of the respondents have open discussions around women's sexual health with other Black women in their circle, and they also talk to family and friends and co-workers. So that friends influencing friends concept really does work. 32.1% of the respondents ranked access to health care, that there was a lack of cultural competency with the doctors and the hospitals and medication access, and they named that as the most important factor and the highest indicator for success, for them to be successful. 23.4% selected social support, having that stability at home, a loving and supportive relationship with their spouse and partner and family as one of the other most important factors. 20.4% indicated sexual behavior, including the number of partners that they had, their sexual orientation, condom use, and the frequency of different sexual acts also played a significant role. And interestingly, only 19.7% of the respondents seen economic stability as the greatest contributing factor in being successful with HIV prevention efforts. And then a few others talked about all of the issues, including trauma. All right, there's other components to our EmpowerHER campaign. We have an in-person and social media EmpowerHER campaign where we host and attend community health fairs and distribute resource information. We utilize audio-visual materials to promote the Risk to Reasons EmpowerHER campaign through Facebook, X or Twitter, and Instagram. And we have a monthly newsletter, and right now we have over 1,300 people receiving our newsletter, which I think is awesome. And we also have our Well Sister podcast on Spotify, and that's where we really talk about all kinds of health issues for women, but in particularly sexual health. So my last little 34, 33, 32 seconds. Call to action. Reaching Black women is critical. It's clear that many women, particularly in semi-rural environments, are not hearing enough about PrEP and NPEP, and we need to provide information to those communities who need it the most, which is part of our mission. Thank you.